people need to realize that healing takes time, being healthy takes time, because down the road, it's going to save you money in the long run. It's going to save you time in the long run. You spend more time with your family, your kids, doing things we want to do, rather than spending that time going, oh, Doc, I know you told me to do this 6 months ago, but now I'm really struggling.
Episode number 2 is with Dr. Casey Berry, chiropractor and operator of All Star Chiropractic, located in South Kansas City, Missouri, who will be discussing health and wellness through chiropractic care. My name is Eric Mojica, your host for the K and Chats podcast. Dr. Berry has his doctorate of chiropractic degree from Cleveland University and has completed his undergrad with Avila University. At Avila, he was also a pitcher for the baseball program from 1999 to 2002. In today's show, Dr. Berry brings 12 years of experience to the adjustment table, pun intended, as he tells us his thoughts about what being healthy truly means and what it takes to find a sustainable, healthy lifestyle. Chiropractic is more than cracking bones. To Dr. Berry, it is about taking the opportunity to serve his community and helping people learn how to manage and potentially get rid of pain and discomfort that can take place in everyday life. For students thinking about getting into a chiropractic doctorate program, Dr. Berry also discusses in this podcast what the process is like now he's gotten to where he's at in his career. For those of you who have never worked with a chiropractor, I encourage you to watch and listen to this interview and learn more about this kind of service. If you deal with chronic pain or physical limitations, I encourage you to learn from Dr. Berry's knowledge and experience with the human body to help you figure out what approach might be best for your health and wellness. As it is written on his office wall, the power that made the body heals the body. So turn up your speakers, put on your headphones, grab a pen and paper, and get ready to listen. Episode number 2 of K and Chats begins right now. Good morning, Dr. Berry.
Good morning, Eric. How are you?
Good to see you.
Good to see you.
All right.
Yeah.
So welcome to our show, K and Chats.
Yeah, thanks for having me. Yeah,
absolutely.
This is awesome.
All right. So All Star Chiropractic, tell us a little bit about it. Tell us about what you do and just your services and your education background. And what
All
you
right.
want to talk about.
All Star, we're a clinic. I bought this clinic 10 years ago coming up from a guy that was actually played at football at Mizzou, and then he played in the NFL. That's how I got the name All Star Chiropractic. I was a baseball player at Avila University. That's how you and I met, and I just kept the name All Star with the sports background, and so now what I do is I do a lot of sports medicine. I do a lot of pediatrics. I do a lot of family medicine in my office. If you walk around the office, you're going to see a lot of sports memorabilia just because I'm a sports guy. I'm more of a baseball guy than anything, so we got to keep the baseball alive.
That's how we click.
Yeah, that's how we click. Yep. So you're a pitcher, I was a pitcher, so works out pretty good that way.
Mm-hmm. And so, what is chiropractic? Because people just kind of think about just cracking bones and whatnot. So,
yeah,
tell us a little bit about it.
So chiropractic's gotten kind of a crazy bad name over the years. It's like, oh, I'm going to go get my bones cracked, I'm going to get my body cracked, or I'm in pain, so I'm going to come in. People don't realize the benefits of it with getting adjusted and what that does to our nervous system. Because if our nervous system is being encroached upon, it's being interfered with, that's the process of chiropractic, is to remove that interference. We want to remove it from the upper cervical spine and the neck and just work our way down. A lot of times we can just mess with the neck and it will completely clear all the problems. We keep that nervous system clear with those bones off of the nervous system, especially the spinal cord and the upper part of the brainstem, then our bodies start to reproduce and heal better, and the cells and everything, the response of the body's better when we do that. Pain's just a response. It's just like the fire alarm that goes off in our body. A lot of people I'll go in 3 or 4 times, the pain goes away, and they're going to stop coming in. It's not really the way chiropractic is. That's really not what chiropractic's all about. So it can be a struggle some days here at the office explaining things to people. Mm-hmm. Yeah.
And so, what clientele do you have? What's the background of most people that you work with?
I would say the majority of my patients are women. I have about 75% women. Probably of those that have sent in their significant others, probably 20, I'd say probably more like 80% of the men that come in are because their wife or girlfriend or a friend sent them in. And then I take care of a lot of athletes, high school kids, Avila University kids, and really big into pediatrics. So I have a lot of kids, babies running around here, or crawling around here with moms. And so we have pretty diverse group of people that come in. It doesn't matter where they're from in the Kansas City area. We have a lot of people in here from all over the city. So,
and so the pediatric part, I'm sure that kind of freaks out some people thinking that you're cracking bones on a baby. But what's that process actually like?
Anybody that's been to a chiropractor, they know that usually you lay on a table and you got me. I'm a big guy pushing on somebody. Babies they're so fragile. I usually use the fingertips, and I let the baby do a lot of the adjusting themselves. Just holding the baby, rocking the baby, putting pressure on the bones where they're at. The baby will move into it, and it will align those bones just like they're supposed to. But then there's sometimes I'll hang a baby upside down, and they'll kind of gyrate, and they'll look like they're doing a little dance, and they'll set their own spine. What that does is it causes their immune system to improve and be better. Babies that are adjusted within the first week have been proven to have a better immune system than those kids that have been ignored and not been adjusted. So it's kind of tricky. More often than not, the dads freak out more than the moms. The moms are just kind of there watching, and dads are in that protective mode, and so I have to go have them stand in the corner or just get away and watching the baby. And the babies do well. They might cry a little bit, but they're not used to somebody else holding them and doing stuff. So it works pretty good. It's fun.
And so what can cause those type of alignment issues with a baby? Is it just the way that maybe they sleep? Is it possible like the way they're carried around in their baby seats, or what do you think?
So the biggest problem is birth. So whether it's cesarean or normal vaginal delivery, the babies when they come out, they're usually pulled a little bit by the doctor or midwife or whoever's helping with the delivery process, and it causes these bones to misalign, especially in the upper cervical spine. And that's what causes it. And then you put them in 12 years of doing this, I've noticed that the car seats that are made, they're not made the best for these babies. They're hard, they're rigid, they're plastic, and then if they do have any kind of cushioning, it only goes part of the way down the spine, and it's not supporting it. So I'm spending a lot of time explaining to moms and dads, you can put some more foam rubber in there, just go home and find a towel and cut it up where you can put the buckles through there, because it's really bad on these baby spine because they're getting bounced around in those cars. Even no matter how much you strap them in, it's a pretty good damage on their spines. Yeah.
And so when it comes to adults or even teenagers up into adulthood, what causes all these alignment issues? Because there's a variety of things, right, from a postural standpoint. So
yeah, posture's a big thing with the kids nowadays, and Eric, you're younger than I am, so when you were in high school, cell phones were prevalent. Not as prevalent as they are now. They probably didn't have all the stuff, but nowadays kids are on their cell phones all the time. They're looking at electronics all the time. They're playing video games. Yep, they're looking
right there.
They're looking down. I mean, I have kids that come in. I get onto them all the time. You got to look up. You got to look up. But I'm talking to these kids about it. But then the moms and dads. I have other adults that are coming in like that. I think we're all kind of guilty of that. But and then with kids, they're sitting in class from kindergarten through their senior year of high school. These seats aren't ergonomically correct. They're slouching. They're bored. They're not doing anything. And so it's all sorts of postures that we put ourselves into, and then it's playing sports. These kids that play sports, or they're into some activity. Playing an instrument. You're not in the best kind of posture when you're doing it. I know our coaches and the instructors try to tell us to do that, but you're a baseball player. You're not always in the right position all the time when you're diving for a ball or when you're pitching or something. The ball's back up the middle. So all these postures and everything we go through in a daily life cause our bones to go out. But it's not just the physical stresses that we put on it. It's chemical stresses, like the stress we have in our mind and what our body's response is to something. It can cause these bones to misalign. And then just like the physical, chemical, and emotional things that we go through cause our bodies to stress out, muscles to tense, nerves to fire differently. And then when all of that happens, bones start to move and manipulate and get stuck where they shouldn't be. So it's a process, and that's why I want people to understand that it's not about pain when you come into the chiropractor. Yeah.
And so what else can you say about pain? Because pain is just a message, right, that's being sent to the brain, usually that something's wrong.
Yep,
and
absolutely.
So, as far as like how the average person interprets, what can you kind of tell about just how the human body works and just everything, the way that the body processes all these hormones and how do these adjustments and everything else in the lifestyle kind of influence how to improve all these malfunctions?
Well, yeah. So on that, I said earlier, it's like the fire alarm's going off when we have that pain. It's our body's response telling us there's something going on. And we often think, we were in the garage this week and we're moving some boxes around, and that's what I get a lot in the office is I was doing something around the house and my back went out. Well, your back went out and the pain started maybe on Saturday, but there was something that was going on further. And what happens is we as a society, we're so into this loop of we feel good, like I feel fine, like I don't have any pain and I look good, I'm walking around fine, and that's our response to that, we're healthy. But what we don't realize is our nervous system might not be healthy. So I tell people in my office when they come in, I explain to them that the weight of a dime on a nerve can decrease their nerve impulses by 60% up into their body. So that means your body's only running at about 40% out to whether it's that nerve that runs down the arm, down the leg, or if it's up on the brainstem, then it's running down the whole body. And pain is subjective. Like if whatever shoulder pain you have, I could have the exact same thing going on, and my pain might be a 1 out of 10.
Mm-hmm.
Yours might be a 9 out of 10. It's subjective. It's each person's individual at it. So I will acknowledge it at the office, and I will meet people where they are as far as, I got low back pain or I have neck pain. But the deep-seated rooted problem is I want to adjust it, I want to check it out. Because those bones, you adjust them, they're not going to stay there right away. I mean, it's going to take time and repetition to get it, and that's where we have to get rid of the pain. The pain's going to go away. And what we have to get people to understand is just because we don't have the pain and we feel like we're fine, doesn't mean we're always healthy and fine. And so I think that's the biggest problem with a lot of the epidemics in this country, especially with the opioid crisis and everything. We're so attached to pain that it really is starting to kill a lot of people.
Mm-hmm.
It's scary.
Yeah.
Yeah, because now kids are on it, parents and families are on them, and families are falling apart because of all that stuff.
Mm-hmm.
Yes.
I think that's something that's really common anywhere in the health industry, just about we seem to look for shortcuts. We don't look to find the root of the problem.
Yeah.
And so, yeah, I mean, it's really easy. I know in my personal experience, I know there's a lot of great doctors out there, but I've had doctors that say, all right, just take this pill.
Yep.
And nothing helped. Like when I had my herniated disc, they just wanted me to take, it was like almost a gram of ibuprofen twice a day.
Yeah.
And all it was doing was messing up my stomach. And I mean, I was eating the way they told me to and whatnot, but it wasn't doing anything for me. And it wasn't until I discovered finding you and getting adjusted, but not just that, but doing exercises. And so I'm a big believer in that, is that you can come in here and get adjusted, but if you don't do the exercises that help maintain those positions, those muscular imbalances per se, then your body's going to go back to what it used to be.
Absolutely. And and people want to, they want to do physical therapy, or they just want to do the chiropractic, they want the easy fix, like you said. And if you couple some things together, we're going to be so much healthier, because we got people that have a roll prop posture forward. Well, I can adjust them, and the body's going to start to re-educate itself and realign itself. But if we start strengthening those muscles on one side, stretch them on the other, people are going to get a lot better. It's just time management. Like we always have this. We all have 24 hours, but we fit work in, we fit our kids in, we fit this and fit that in, but we forget to fit ourselves in. And then what happens is we're not healthy because, you want to do this for 10 minutes? That's a question. I got to do these stretches for 10 minutes? Yeah, 10 minutes.
Out of 24 hours.
Yeah, that's all you need. Well, I don't have time. You make 10 minutes for yourself, because what you're doing is you're saving your life down the road. And that's what people don't understand, is they might spend a little time now doing all this, and you're a trainer, you do all this. It's going to take time to get there. You can't go, no one can lift with you one day and be Mr. Olympia.
Yeah.
And so people need to realize that healing takes time, being healthy takes time, because down the road, it's going to save you money in the long run. It's going to save you time in the long run. You spend more time with your family, your kids, doing things we want to do, rather than spending that time going, oh, doc, I know you told me to do this 6 months ago, but now I'm really struggling. Well, now it's going to take you a year or 2 years to get better. And so that's where people really get into the problem is, well, I got a steroid shot. Awesome. It didn't fix the problem. It masked it. That's what I want people to understand, is There's so many things that we could do out there between, like, you and I could work well together. I adjust patients, send them over. You take care of them with your expertise, and people are so much healthier. It's going to help our communities too.
Mm-hmm.
That's the biggest thing. But people just want the quick fix, and that's a problem these days.
Yeah.
All right, so we're going to adjust Eric since he interviewed me, and he's one of my patients. So we're going to check him out. Eric was a baseball player. Apple is a pitcher. And pitching causes a lot of torque on the body. A lot of people don't realize how much torque pitchers go through. I was a pitcher. Eric's a pitcher. Eric has a lot of problems down here in his low back, some bulging discs, everything. We've been taking care of it for, what, 4 years?
Somewhere around there?
Yeah, so keeping him on the field when he was down there playing. And so what we're going to do is I'm checking his spine for just subluxations of the spine. So we'll go through and I'm going to adjust him. Start up here. Relax that. There we go. Do this side of the table so you can see what's going on. Using my hands on the spine. Alright. Now we're going to focus on this low back of his on this side. Other side. Oh, I was already ready to go.
Easy.
You know, when we adjust this neck, we open up that channel from the brain down the brainstem, allows everything down low to heal itself. And we get all the other subluxations out of the way, and we start getting things moving. There we go. That's it.
Feel taller already. For those that are interested in getting into chiropractic care, what is the schooling like? Like, what's the process?
So it's more vigorous than people realize. I mean, I was in school. I wanted to be a medical doctor. I was going to be a surgeon, and I got hurt. Went back to school, and I had to wait a year for med school. So I was going to go to I was like, I'll go to this chiropractic school, see what it's all about. And I thought growing up, the chiropractic school was just you learn to adjust bones. You might learn a few things about anatomy, and then you go, boom, you're a chiropractor. Well, I did 4.5 years of undergrad. I had a bunch of science background, and so you had about 120 hours of science. And when you go to chiropractic school, you're in school from 7:30 to 4:30 for about 3 years. And we're learning everything a medical doctor's learning. I mean, we're learning the anatomy, the physiology, the chemistry, the body chemistry. We're learning stuff about medications now. And we trade out a lot of the medication, pharmaceutical courses, trade it out for adjusting courses. And we do some physical therapy. We do a lot of physical therapy stuff. And so it's medical school. Well, we trade out some things, but it's directed by our board. So the 16 schools that are still out there, we have to follow their guidelines. And the guidelines are, we have to keep up with certain standards of care. But when it comes down to it, the philosophy is what's different. And so it's 4 years of vigorous school after the first 4 years of college. And I think we figured it up one year. We were taking 95 tests a semester, and then you added in 5 parts of our boards. So we were taking tests we had trimesters, so we went year round. Mm-hmm. And so it was you didn't have a life.
Yeah.
It was, you're going to become a doctor and you're going to learn how to take care of people, or you're going to change and you're going to be like, I can't handle this anymore. Mm-hmm. And we had 30 start with me, and I think of those 30, 20 of us graduated, mm-hmm. which is pretty good percentage wise on that, but it's still rough. But it was worth it in the end. Mm-hmm. So.
Yeah. And I had the same notion early on too. I thought maybe a couple of years you just learn how to just put your hand on people and do things, and I think that's for a lot of people, and that's why there's sometimes this notion that going to a chiropractor is a little dangerous and it's risky. Yeah. How often do serious injuries happen with?
Not often. There's a lot of this talk about the stroke incidents with upper cervical adjusting. and it's, if you look, there's less than 1% chance in a million adjustments that somebody's going to get a stroke from or associated with a chiropractic adjustment. And if you look at that and then you add like spinal surgeries or any kind of surgeries like appendectomies, adenoidectomies and tonsillectomies and things like that, people die more from those and are injured more from those than they are from a chiropractic adjustment. Because I think what people don't realize is they watch TV. Like we all watch movies where you watch an action movie, somebody's neck gets snapped. And it's like, that dude barely moved his neck and he's done. So we get this fear. We get this fear inside of us, and we don't realize how the structure of the body works and how smart our body is to not allow that to happen. It will restrict me. Like, I can't move a bone any further than it wants to go. If I tried, we're gonna have some injuries. And you know, like insurance, car insurance, home insurance, any kind of insurance is all dictated on risk. So like my health insurance or my malpractice insurance a year is like $1,600, where medical doctors $20,000-$30,000, and then your OBGYNs are in the 50s or hundreds of thousands of dollars. So the risk isn't as much there as I think media likes to perceive. And chiropractic needs to do a better job of educating. That's the thing, is like doctor means teacher, and we got to start teaching the communities about the health and welfare of our people, but also teach them what we do. And that's what I really have gotten into in the last year, is really educating my patients better. Because you come out of school and you get this big educated mind and you just throw stuff at people, and people don't get it. So you got to dumb it down. I got to dumb it down for me. I just have a certain philosophy. I let the body heal itself. There's really nothing crazy about it. It's just people need to understand it. And they say, well, I don't believe in chiropractic. That's fine. Give it a chance for 6 months. See what happens to your body after that. You don't have to have pain. Just come in, go get checked. If the chiropractor, he's going to find a subluxated bone, just a misaligned bone. Let him adjust it. See what your body does over the course of 6 months. Then you can decide. You know, don't decide about 2 or 3 times of it, 2 or 3 visits, and then be done with it. Yeah, because nothing's going to happen in 2 or 3 visits that you want to happen.
And that's kind of the golden challenge for us, right? Like, I know for myself as a personal trainer, somebody wants to lose 30, 40, 50 pounds, and they expect it all in a month. And
yeah,
part of my struggle as a trainer is I have to constantly communicate with them and let them know, hey, listen, before I have you doing all this crazy stuff where you're going to get some crazy sweats out of it, we need to work on the foundation. We need to work on foundational movements and build off of that, so that way then we can really increase the intensity, and then you're going to really see those results.
Yeah, and that's the way it is here, and I think you and I get it. And sometimes I find myself explaining things as a baseball player to people, because people get sports. And they get sports a lot better than health. And so I explain to them, you know, like I was in college, I played baseball, and we did the same thing day in and day out. It was just habit. Let's go take grounders. Let's throw the ball. Let's do this. Let's do that. It's the same foundation you have to build on as athletes. You have to build on with your health. You have to start somewhere, and then you move your way up. And your job is difficult enough because people aren't doing the right things for their health, and I'm sure you probably run into it where you have to teach them the proper mechanics. Then I have to teach people the proper mechanics in here, and they just want to be in, out, and on with life, and they don't realize that their life is completely dictated by what you and I do, is their health. And so I think that's important for all of us, is to make sure our people are educated. Yeah, and it's hard.
Oh, yeah.
Yeah, it's a struggle day in and day out. You ask people to come to a class to teach them something, they're like, I don't have time for that. Well, you have time to die? You know, like, which one are you going to pick? That's what I want people to understand, is we got to get people to just understand that their health is the most important asset they have.
Yeah, and I think that's something that's really common. We think we value time because we're like, I can't do this because I got to do this.
Yeah.
But I've learned through my years of school, and now I'm in my master's degree, I'm going for it, and I realize, like, I feel like I don't have time, but I do, and it's just a matter of balancing and making time for myself, for my own health, because I already have a couple years of back issues, and I get it for the average person who says they don't have time, because I struggle with it too. Yep. And so for all our listeners here, you know, you're not the only ones.
Nope, I struggle with it too. You just have to balance what's more important, your health. And your health is important for you and your family and the people around you, and everything else will fall into place. And I'm a single dad. of a kid that plays softball, you know, has the same rigors of an athlete as we went through, but now I'm on the other side of the, you know, flip side of the coin, and it's a time management struggle. There's nights I'm up late reading or doing things like that, or catching up on stuff for the office or at home. But if I make that half an hour every day to take care of myself, that half an hour just is huge by the end of it, because then you're happier, you're healthier. Do something, get up 30 minutes early and do it in the morning before anybody gets awake. Do 50 push-ups and 50 squats and then walk around the house for an hour. You know, you'll be good. It's better than sitting around going, I don't have time. Yeah, because we just have to take care of ourselves, and that's what people don't understand. Yeah.
It's great stuff.
Yeah.
So just to end it on a little fun here, any really cool stories that you have, any personal client stories that you might like to share?
Yeah, I have one that really hit close to home. It was not this May, but May of 17. I was on Facebook, and a girl I grew up with. So her husband had posted this video of her, and she was putting a brace on her left foot. I think it was her left foot. And Tanya has MS. So she started getting MS when we were 19. So she's had it for about on and off. It's progressed over the last 20 years. And so they live in my hometown of Warrensburg, about an hour from here. And it hit home that, like, I can do something. Like, you know, I know she's on all these medications and all of this stuff, but it's a neurological problem. I deal with the neurology, but it was just something about me that told me, like, my inside said, you can help Tanya. So I reached out to her husband, and then got him to come up. Well, Tanya came in, she's on a walker. Now, last year I was 38 years old, and you see somebody your own age when you're not even 40 yet, it hits home. And I remember sitting in my office about a half hour after she left, and I was kind of in tears, because it was like, damn. I mean, I've known her since we were kids, and we're not even that old, and she's on a walker. And so I started adjusting her, and I made him come up. You got to come up. You got to come up. You got to come up. And Tanya walked in 2 Saturdays ago, and she misses. You know, it's an hour away, and Tanya walks in without a walker, and she's been walking without a walker. She didn't have that brace on. She's still a little unsteady, but I'll tell you what, just her levels that they look at for MS have changed. They've improved. I think she's gotten off of medication. So Tanya actually walks in my office 2 weeks ago and doesn't have a walker, not using a cane, and still rigid because she hadn't been in about a month. I adjust her, she gets up and walks out with just a little bit of a limp, and that's what chiropractic did. You know, she was on all these medications that were supposed to change this. Well, that's healing from the outside in. We're trying to put something from the outside into the body. We often forget that the inside out is approach. You know, you cut your hand, and all I did was adjust her. I let the body do the rest of it, and I don't know. I mean, I threw everything in the ring with her as a friend, but also, I mean, as a chiropractor, because if you're gonna have the guts to reach out to somebody and say, I think I can help you. You don't know. I mean, I don't know what her body was going to do. I had no idea. We didn't learn about any of this in school. We were just learning the power. You can see it up here on my wall, Eric. It says the power that made the body healed the body. The brain will do everything. It will control everything. And that's what I did. I adjusted her. I opened the channel, and she's walking. And it's pretty miraculous when I think about it, that all I did was I did a little simple step. I adjusted the bone, got the interference, and her body did the rest. And that's my miraculous story for, I think in 12 years of practice, that's one of the coolest things I've ever seen. And it really hit home because it was a friend of mine. Mm-hmm. Yeah. Wow. Yeah. So it's pretty awesome. That's why I get up and come to work every day, because you don't know how many miracles you're going to see every day. I could see one today. I start work here in a little bit. Every morning I ask God for a miracle, see what happens to somebody. Maybe somebody's praying right now and they're like, hey, go see this guy. Go see a chiropractor. It don't matter. We'll adjust you, see what happens. Yeah, so that's why I get up and come here every day.
It's the power of chiropractic, right?
That's right, brother. The power of chiropractic.
That's awesome.
Yeah.
All right, well, thank you for your time today.
All right.
I'll be in touch. I will be.
Thanks for having me.
Adjusted.
Yeah. All right, brother.
Thank you.
You're welcome. All right, if you want to find me at my office is All Star Chiropractic. I'm at 133rd and Holmes in Kansas City, Missouri. Phone number is 816-942-6066, or you can also find us on the web at allstarchiropractickc.com. Thanks, guys. Have a good day.
And there it is, folks. Episode number 2 is in the books with another fantastic interview. If you would like to contact Dr. Barry, you can find him on Instagram and Facebook, as well as his business site at allstarchiropractickc.com. Dr. Barry and I have worked together for over 4 years at this point and has played a major role in my life as an athlete and in my time removed from the competitive field. As it was briefly mentioned in the interview, I was diagnosed with 2 disc herniations in my lower back the summer going into my senior season of college baseball at Avila. Doctors prescribed me with anti-inflammatory medication and suggested getting an epidural injection. Upon doing my own research and speaking to several clinical practitioners, I was advised of the high cost and unpredictability of medication to help my lower back and hip pain. After several months of physical therapy work, along with getting adjustments with Dr. Barry, I was able to hang on to my last season of my baseball career. What made the difference in my life was not that I got to compete for one more season, but rather the people that I learned from through the process of rehabilitating a sports-related injury. Dr. Barry was and always has been a valuable resource in my journey of health and wellness, and just wanted to shout out another big thank you for all his help. Dr. Barry, it has been an honor to have you on this show. Stay tuned for next week's episode with our guest, Brady Morrow, owner of Martin City CrossFit Gym located just down the street from Dr. Barry's office in South Kansas City, Missouri. Brady is a passionate fitness person who is a strong believer in applying the community feel of CrossFit to his gym and using his status and platform to give it all back to the community. He has also competed in several regional CrossFit events and has even hosted his own in the Kansas City area. In this episode, Brady will also share his journey through fitness and how he has come to where he's at today, owning a gym and helping out in the community events. I want to thank you once again for watching and listening, and make sure to follow us on Facebook, Instagram, YouTube, and SoundCloud for the latest content at KN Chats Podcast. You can also find the links to our content via our website at knchatspodcast.wordpress.com. This is Eric Mojica signing off. Until next time, this is KN Chats.